Tag TV and Tag Radio be seen and heard by both technology users and technology producers throughout the state of Georgia and around the world. Low cost, big benefits, powerhouse online branded video and audio has arrived. Tag TV, Tag Radio, there's a lot more to know. This edition of Tech Talk is brought to you by Globalspeak.com, new media consultants, corporate video and audio communications, video and audio production and distribution, live and virtual event production. Tag TV and Tag Radio is a service of Globalspeak.com, creatively delivering powerful marketing, video, and audio solutions. Only in its third year, yet it already ranks as one of the nation's premier health IT events. That's right. Last year, it brought together a sellout crowd of more than 600 business leaders, healthcare providers, and public and private organizations. This year's theme, Preparing for the Future, Transforming Healthcare Through Health Information Technology. It's the 2012 Health IT Leadership Summit, December 4th, at Atlanta's historic Fox Theater. Greetings, everyone. It's Friday, November 30th, 2012, and this is a special Health IT Leadership Summit feature focus edition of Tech Talk with Technology Association of Georgia President Tino Mantella. I'm your guest host, Frank Baia. Oh, there's still time to register, but you must act now. The 2012 Summit promises to be the biggest and best yet, and a sellout crowd is expected. Here with all the insights and latest updates, founding chair of the Health IT Leadership Summit, Pat Williams, widely recognized distinguished business leader with extensive experience working with senior leaders from some of the nation's largest corporations. Pat is a leader in driving growth in the health information technology industry in Georgia and is the recipient of the 2011 Phoenix Community Award for her leadership in this crucially important economic growth sector of Georgia by the Metro Atlanta Chamber of Commerce. She is Chair Emeritus of the Health IT Summit, an event founded by the Georgia Department of Economic Development, the Metro Chamber, and Tag Health. President of a boutique professional services firm, McKenzie, Daniels & Associates, her experience includes leadership roles with AT&T and the Bell Systems in the healthcare and lodging sectors, and with the professional services firm Thomson DBM, where she's credited for launching and creating what is today the national standard delivery model for the company's premier division. Board member of TAG Health Society, member of TAG's Government Relations Task Force, and served 2 years on the TAG Board of Directors, on the Metro Chamber Bioscience Leadership Council, Advisory Board for the Georgia State University College of Business, Gwinnett Technical College, and the Atlanta chapter of the Healthcare Businesswomen's Association, all in roles dealing with health IT and health administration. The 2012 Health IT Leadership Summit, Preparing for the Future, Transforming Healthcare Through Health Information Technology. As the details and plans are being finalized, let's speak with the Chair Emeritus of the 2012 Health IT Summit as she prepares for the biggest and best event yet, Pat Williams. Pat, welcome to Tech Talk.
Thank you, Frank. Glad to be here. Appreciate the opportunity to be on the program today.
December 4th, coming quick, Preparing for the Future, Transforming Healthcare Through Health Information Technology, third annual Health IT Leadership Summit. Maybe give us a little background, go into a little bit of the history of how it came about and how it progressed to where it is today.
Great. I'd love to. I can't believe that we're actually at the third summit. In the past two previous years, we've had it in November, and this year it's on December the 4th at the Fox Theater, and we delayed it because of the elections this year. But going back to the question is, how did we get here and what's the history of it? The summit was formed, when we think of a summit, we typically think of gathering everybody together for information, which this summit is. But it was really formed for the purposes of promoting economic growth and development through the health information technology segment of industry. And the Metro Atlanta Chamber, the Georgia Department of Economic Development, and Tag Health all came together with an idea in March of 2010 and said, let's put our heads together and see what we can do to unite and grow this industry segment. And out of that was birthed the summit. Our first summit was in November of 2010.
I think it was almost, to use probably a poor analogy, but a perfect storm. It seemed like it happened right at the moment when it needed to in terms of converging that whole vertical sector. I know the attendance was overwhelming, a lot bigger than most had expected. The speakers were well received right from the get-go. I know the buzz went on for weeks, if not months, after the first one. Of course, all of that was, with that success, led to another booming success from the second one. And again, I think the same thing happened there. I think it was a case where it didn't it validated, I think, what everybody already knew under the surface, and that is that we had leadership, that Atlanta and Georgia was a national leader, if not the national leader in health IT. Let's talk a little bit about health IT. Go into some of the growth aspects of that vertical. What's happened over the last few years?
Well, when we started out with focusing, if you remember in 2010, the job markets were really declining, but not in health IT. And we had jobs.
Mm-hmm.
That was our motto for the first summit in 2010. When we started this, I kept saying, really, I'd love to have 100 companies sitting down there in front of the stage at the summit. And now we have over 250 companies involved in the summit and in our health IT sector in Metro Atlanta and Georgia. So we've definitely grown. And I was just looking at the new stats today, and I think we have more than 28,000 people employed in the health IT sector in Georgia. That number is probably very conservative because after I saw that number, which David Hartnett gave me from the Metro Chamber, I was talking to another company that is probably not even on that list, that because of the nature of their company, but they deal in health IT all the time. So 228 companies is a very conservative number.
Well, and obviously you can multiply that probably by 3 in terms of the crowd. I know the last couple of years it's been a sellout. More than 600 business leaders, healthcare providers, and public and private organizations. So truly, I think the word's overused occasionally, but I think it has become the nation's premier health IT events, or at least one of them for sure.
Well, we think it is. Absolutely think it is. And we do have this rich cluster in Atlanta and in Georgia with health IT. And I was preparing some remarks to say at the summit, and part of what I want to say, I was thinking, why are we here, and so what? Why do all these people come? And I think we're at an opportunity, it's almost in pioneer land, because health IT is about to really boomerang in terms of, grow, I should say, in terms of the growth. We haven't even seen it yet. And I thought, what an opportunity and what a privilege to be here in Atlanta and in the middle of all of this booming growth that we've got going in health IT, and to be a part of it.
Well, I remember last year I think the Rocky theme came up over and over every time you kind of took the stand or took the podium, or someone else took the podium, and the whole idea of the aspiring champion running up the steps and going after the giant accomplishment. I think that's kind of almost prophetic, almost a prophecy in terms of what's ultimately occurred out of it. It's not to make too much hyperbole, but I really think, again, the parallel of what you've been able to accomplish as an event alongside of the actual development of the marketplace, both from a private sector and enterprise of public and private organizations and employment, has just been remarkable. Let's talk a little bit about that. What are we doing to develop a workforce here in Atlanta and in the state of Georgia?
Well, there are several things, and all of them are so exciting. So I'll just try to take them one by one.
There you go.
One of the things is right now we have more jobs in Atlanta in health IT than we have workers to fill. And that's a great problem, but it is a problem. So we need to look for our current workforce and to say what are the skill sets required to fill the need, and do we have that workforce with some minor training and so forth. So last year, Tag Health held a job fair just for health IT, and we had over 20 companies represented, and I think it was over 200 people actually attending. That was the first one that we had. It was such a success that we're going to have it again. A couple of other things that we're doing is that we've got to prepare for our future workforce. And like I said earlier, we're in pioneer land here. Mm-hmm. So one of our challenges and one of our great needs that everybody's recognizing is that we need to start with the students in high school and get them aware of what HIT is, what health information technology really is. And it's like Greek to them at the moment. But it's really technology in the healthcare field and enabling the delivery of healthcare through technology. So it's some disruptive innovation that's going on, which makes it even more exciting. So the Georgia Department of Education, under the leadership of Phyllis Johnson in the health sector, is currently in the process of developing a health IT curriculum for students in high school, and she's doing that with the help of business. We've had meetings throughout the year with various business leaders for their input into what their needs are for these students getting out of school, and then whether they can get a job when they get out of high school or whether they can get a job, do they need to go on to a technical college and so forth. In line with that, the technical colleges and the two-year colleges and the four-year universities are very actively working on curriculums to meet the needs of businesses with health IT. So we've got that pipeline from secondary education all the way through four-year universities. Likewise, under the leadership of the Lieutenant Governor, we are working on a curriculum for the career academies in health IT, and that's brand new. It's just getting started, and those kids will be able, hopefully, to get out of high school and stay, well, for one thing, stay in high school because they see a future for a job to reduce the dropout rate and get a job when they get out or either choose to go on to a four-year university or wherever. But we're working with the education system to do that. So that's what we're doing to work with our future workforce at the time. There's a lot more, but that's enough.
Well, that's pretty impressive as it is. And, I think if I'm understanding now, the summit is to address future healthcare needs, as you pointed out, but also to really look at the use of innovative approaches and technologies to improve the population's health overall, and also the quality and the cost of healthcare. Maybe get into some specifics of why people should attend the summit.
I love the question because that's one of the questions that I'm going to ask them when we get there on Tuesday. Is why are you here? And so what? What's the big deal? Well, I don't know. Everybody has to answer their own question. There are various reasons why people would want to be there. There are various reasons why people want to work in an industry or work, period. But one of the reasons that I hope that they're there is they're beginning to see the growth rate of this industry and the job and career opportunities for them, whether they're at the executive level or whether they're at the entry level, that this industry and this market is going to really provide the opportunity for good careers, good paying careers for them. Aside from that, the monetary and the success within their careers comes, I hope, the satisfaction that it's really doing something for the benefit of people ultimately, that they can see at the end of the day that what they're doing is going to actually help someone. And Frank, if I may, give you an illustration of that.
Sure, of course.
One of the things that we had out of last year's summit was that we wanted to reach more people more efficiently and provide better quality health care in the process of doing it. One of the things that we have really done this year, and the stories will be told at the summit on the 4th, is that through telehealth and Georgia Partnership for Telehealth, we have now reached out to areas in rural Georgia where they did not have access to health care, to quality health care. And we've established school-based health care clinics where those kids can actually go to school, go through a school nurse, see a doctor by telehealth, be diagnosed, have their prescription filled, and delivered back to school and their first dose of medicine given to them before they ever leave the school. And Mama or Daddy doesn't have to leave work to take them to the doctor. And those kids are getting health care. Now, we hope to expand that. We've got 2 counties down in rural Georgia where we're doing a pilot project, and I'll leave that for the summit because people will want to hear about it. But it's all about through telehealth, we're able to reach a lot more people. And the other benefit of that is once we get these school-based clinics set up through telehealth, we can deliver more education on nutrition, on physical fitness, so that we can touch the population to begin to hopefully curtail some of the growth in obesity that leads to other chronic diseases. So it's really impacting the health. That, to me, is so exciting.
It really is. It's the promise fulfilled, really, and the opportunity is happening already, but that's just the beginning. You begin to think of what's going to happen over the next few years and obviously over the decades. Preparing for the future is obviously the theme of the event, Preparing for the Future, Transforming Healthcare Through Health Information Technology. I'm going to take the lead, Pat, and say it's the Fox Theater, and it's going to be Tuesday, December the 4th, starts at 7:30, but there's still time to register. That's as simple as going to tagonline.org, tagonline.org. Should be right at the top of that homepage promoting the event because, again, it's one of the premier events that TAG collaborates and puts on every year. Pat, I guess you've really kind of covered it, but one last point would be, bottom line, what happens if you miss it and what's in it for you if you come?
Well, what happens is if you miss it is that you can still get engaged in this exciting career field that we have. You can contact TAG Health, or you can contact the Metro Chamber or the State Department of Economic Development because this is a joint event but with all 3 entities. Any one of those groups would be glad to tell you how to become involved. And we do have initiatives going on throughout the year. This is a call to action. It's not just a gathering of people. It's a gathering of people to decide how can we work together to grow this industry. What
a great point. I've often said that these events really aren't the conclusion of the conversation. They're just the beginning of the conversation, and I think that's the point that you've made over the last couple of years and continue to make even with this year's event. Tuesday, December the 4th, 7:30. It's still time to register. If TAG members want to get more information, as I mentioned, it's tagonline.org would be the first stop. Pat, to say thank you for the work that you've done. I know that you're kind of a humble person and really don't want to hear a lot of accolades, but the truth of the matter is that you were a voice in the wilderness and took some of the first steps and helped to get others to take steps along your side to ultimately lead to the first event that now has led to this booming industry acceleration. I think we owe you a tremendous amount. And you know what else? It's not only an economic development thank you, but it's also a healthcare thank you because it's helped in so many other ways, both directly and indirectly, in terms of better health for everybody in the city and for the state of Georgia, and obviously for all of us that eventually will need health care in one kind or another. Pat, thank you so much for taking time out of what is, I'm sure, your busy schedule leading up to the big event next week. And also thank you for taking time to join us for a few comments today on Tech Talk.
Thank you so much for having me.